Well, sometimes it's not good to be number one. Mississippi ranks first in the nation in heart disease and strokes, but knowing a couple of simple numbers can help lessen your risk.
High blood pressure and high cholesterol can both contribute to your chances of suffering from cardiovascular disease. Kamari Hamer ran the numbers with the medical professional, and he joins us in the studio with more. Kamari.
Blood pressure and cholesterol. When one of these are high, you need to take note. When both are high, you may need to take action. And if you throw in a family history of heart problems, sooner is better. According to the CDC, nearly half of the adults in the United States have high blood pressure, and about 10% have high cholesterol, but that number is over 30% in Mississippi. Either of these conditions can increase a person's chances of heart disease and strokes. Amy Bogue is the president of Allegro Family Clinic. She says knowing the numbers of your health should be a big priority.
You want to get a baseline, so everybody needs to get a checkup at some point. That way you know what your normal is, and then when you get sick, numbers tend to change. So honestly, everybody should know their normal blood pressure range. Well, to know those, you need to know the normal numbers. So they recommend around 120/80 is your normal. They tightened it up a little bit, so if you have 120/130, they're like, wait a minute, that's moderate, and now they're calling 140s/90 high. So it used to kind of be a little bit looser, but they've tightened those guidelines up a little bit.
Bogue says there are several things that can take a toll on your health.
I would say stress would probably be the number one thing, which most everybody is stressed in some form or fashion. Different situations, they call it white coat syndrome. Sometimes people don't even like to come to the doctor's office, and when they get in the lobby, they kind of start getting anxious, and that can raise your blood pressure. So underlying conditions, if you have different types of medical conditions, you might increase your blood pressure too. Different fluids can do it. There's so many things that can affect your blood pressure.
Bogue says genetics can also affect your overall health.
There's some things like a family history you can't help. I have high cholesterol in my family, so what can I do? Diet and exercise to help it. It's going to run high because it runs in my family, so I need to know what is my baseline number, and then I need to know when that changes and if I need to get on medication for it.
Now, Bogue says everyone should get a wellness check once a year to stay on top of their health.